All right, let's see what 12 News Arizona says. And there's a lot to unpack here. So I'm going to pause this quite a bit. Already driving me crazy.
New data shows thousands of Arizonans are no longer actively enrolled in Affordable Care Act health plans.
Yep, that's because it's terrible.
According to the new state data, more than 357,000
Oh, wait, can we just point out how old the computer is? Where are they filming this at? Like a public library?
Arizonans selected ACA coverage by the January deadline, but by March 1st, just over 360.
Yeah, the reason why you have over close to 50,000 people that drop off is because the federal government puts requirements on there to submit income information or income verification or identity verification, and then people don't do it, and then they get dropped.
6,000 people were actively enrolled. That's a drop of more than 50,000 people. Experts say higher premiums.
Yeah, it wouldn't be because of higher premiums because people already know what the premium that they already agreed to, which would have been in January, and then they get into March. So it's not like it randomly jumped on them.
Higher deductibles and the end of enhanced federal subsidies might be making coverage more difficult to afford.
Now, I will say if someone got their coverage last year and then all of a sudden they ignored all of the paperwork, all of the emails, all of the, the mail, the snail mail they get, then yeah, this has happened. This happened to several of our clients, and we just moved them over to private plans, and they're 10 times happier because of it.
The biggest concern here, health policy experts say it's unclear whether these people found other insurance policies or if they're now just living without coverage.
Yeah, most people just found other coverage because other coverage is 10 times better. Like, I will tell you, I was on the Marketplace 3 years ago. My son broke his leg. I went to Children's Phoenix Hospital. They said, yeah, you're good. And then I get a bill in the mail saying, hey, you're not in network. And then I had to go to an orthopedic surgeon. And the orthopedic surgeon, even though we weren't in network, wouldn't see my child unless Phoenix Children's Hospital released the records, which then they took forever to release the records because we weren't in network and they wanted the insurance, the pre-authorization. It was a nightmare and a mess because it was HMO. And it's federal government.
They warned that if more Arizonans do become uninsured, it could put additional pressure on hospitals as well as healthcare providers across the state.
Yeah, I mean, kind of. But again, this is why people are finding other health insurance because the federal government can't control an actual health plan because they're forcing insurance companies to take everybody, which then means that there's no risk pool, so that they're always playing a catch-up game. And guess what? They're always passing the bills on to everybody else. In private industry, they have profit margins, they have controlled risk pools, very easy to handle that. And that's why the federal government is almost 2 times the amount of a private plan now.
For more information, head to our website, 12 News.
Yeah, so don't let the news scare you on this, and half of that's untrue. Hey, thanks for watching the content. If you want to have better health insurance, whether pricing or coverage, you want something different or new, you want something where you feel like you have hands-on support from a live agent in the actual process of getting the policy and the post part of actually filing claims, please go to our website, click on the link below, or fill out our lead form. You'll catch a live agent. Our focus and intention is service, and that's all we focus on. And so if you want to work with someone who will hold your hand through the entire process of getting your policy to helping you file claims when that is necessary, you've got to work with us because let's just face it, we're the best.